I received a call from a patient the other day to tell me about this new proven treatment that he was undergoing for his erectile dysfunction. This had cost him $3,000 cash out of pocket and was being offered by an unscrupulous physician who wasn't even a men's sexual health expert. I'm Dr. Brian Christine, and this is my fellow, Dr. Chris Graziano.
On this edition of the Erection Connection, we're going to touch on alternative treatments that you may encounter as you seek treatment for your erectile dysfunction or Peyronie's disease.
Men with erectile dysfunction and Peyronie's disease are highly motivated to find effective treatments, and there are effective treatments out there, but unfortunately there are doctors who will offer unproven, expensive treatments to the patients.
One of those treatments is PRP, or platelet-rich plasma therapy, which is an injection of your own platelets that doctors will often tell you is used to treat your erectile dysfunction. Some doctors may even call it stem cell therapy, but it's not. There's just not enough data out there to tell whether or not this is going to be an efficacious treatment for your erectile dysfunction. Other therapies that you may hear about include shockwave therapy and stem cell therapy. Although there is some data suggesting that there may be some benefit to these treatment options for your ED, they are still considered investigational.
So what are our recommendations? Number one, make sure the physician that you're seeing is a board-certified urologist who's an active member of the American Urologic Association and preferably also the Sexual Medicine Society of North America. Now that's true for here in the United States. Other countries have their own governing bodies. Make sure the doctor is a member in good standing of those governing bodies. Number two, ask the doctor to show you journal articles that prove that what he or she is offering has efficacy in human studies and show long-term benefit. They won't be able to. Number three, if they're requiring you to pay large amounts of cash out of pocket for these procedures, don't do it. Go the opposite direction.
We're not trying to tell you that you have to come see us. There's many sexual health experts across the country who'd be willing to help you.
Well, there you have it. There are treatments for erectile dysfunction and Peyronie's disease that are legitimate and effective, but there are also other treatments that are unproven, that are expensive. You want to avoid those. That's it for another edition of the Erection Connection. If you like today's video, well, hit the like button. And please consider subscribing to the Erection Connection. If you have friends or individuals who may be potential patients, share the video with them. And check out my website, drbrianchristine.com. On the website, you'll find information about all the different conditions that we treat. We'll see you in the next edition of the Erection Connection.